Good afternoon, everybody, and thank you for joining us for London Health Sciences Center's March Community Update meeting. Before we begin, I want to take a little moment and hand things over to Deborah Wiseman, who is LHSC's Vice President of Medicine, Emergency Services, Critical Care, Clinical Neurological Sciences, and Corporate Nursing Executive. Deborah?
Thank you, David. I'd like to do a land acknowledgement. London Health Sciences Center is situated on the traditional territories of the Anishinaabe, Haudenosaunee, Lenapewauk, and Chinungtung nations, on lands connected with the London Township and Sombre Treaties of 1796 and the Dish with One Spoon Wampum Covenant. The three Indigenous nations that are neighbors to London are the Chippewa of the Thames First Nation, the Oneida Nation of the Thames, and the Munsee Delaware Nation. I am privileged. I am a settler. I am learning to be an active ally, which for me means using my privilege to listen, learn, take concrete steps towards reconciliation. I honor and affirm the Indigenous rights to lands, education, and health. I'm grateful for the First Nation, Indigenous, Métis, and urban Indigenous peoples who have cared for the land on which I live, play, and work since time immemorial. In addition to more recent learnings, I continue to educate myself on the horrific and destructive impacts of colonialism. I work to act on my commitment to contribute to reconciliation and make this commitment personally, but also acknowledge the importance of using my opportunity as a healthcare executive to support and act on meaningful change. As such, I take my current position as leader of the largest employer in London, a leader who has the authority to make decisions as required to support changes that make tomorrow a better than today. Thanks, David. Back to you.
Thank you, Deborah. And so for those of you who are turning in for the first time, I welcome you. This is our third community update meeting of 2025 and our sixth one overall if you're keeping score. So these sessions serve as a platform to keep you informed about what's happening within our organization, share updates on the new initiatives, and outline the steps we're taking to deliver on our promise of excellent care. These meetings are live streamed through our website and social media channels, and a recording's made available afterwards. Also, a new added item from last month is our meetings are also being replayed on Rogers TV London. So whether you're joining us live or catching up later, we're making every effort to reach as many people as possible with these meetings. And as always, we're here to listen and respond to your questions. A lot of you have reached out to me and continue to do so by emailing me directly at the Office of the Supervisor, that's all one word, at lhsc.on.ca, or by calling me on my cell at 519-870-2999. Again, 519-870-2999. So I want to give you an update on a couple items. The first one is regarding how we continue to keep our staff, physicians, professional staff, patients, and visitors safe at LHSC. So clearly, keeping a safe and secure environment remains a top priority at LHSC. And we recently announced we're going to be installing the new weapons detection system at the entrances of our Victoria Hospital and Children's Hospital and University Hospital emergency departments. So this system, for those of you not aware, is very different from our traditional metal detectors used in airports or other venues you might walk into. It uses non-intrusive AI-powered screening, allowing individuals to walk through without slowing down even their gait and without having to remove any personal items from their body. If there's a potential threat is detected, security personnel will receive a discrete alert pinpointing the item and its actual location on the person. And this is an important step in enhancing safety while maintaining a welcoming hospital experience and not slowing people down. Also, it's not connected to the hospital's IT system at all, and it doesn't involve any patient information whatsoever. So as stated in December last year, 2024, We immediately procured these items and promised it would take weeks or months, not years, to get them on site and up and running. Since our last meeting last month, we've received these items, these detectors, from our local distributor, Convergent Canada, and have set these systems up for training for our team members at both hospital sites. And that's the work that's happening as I speak. Once the training is complete, the detectors will be moved into their permanent positions at the emergency department entrances. The system's expected to go live at University Hospital's ED on April 15th and Victoria Hospital in May. Since our last meeting, we received a question from a community member about the cost of these detectors. LHSC is leasing the system at a cost of less than $8,000 Canadian a month for both devices combined. We have a 4-year lease. Again, this is for 2 devices and it supports ongoing maintenance. So we want to ensure the safety of our patients, staff, visitors, and it's a responsibility, as stated, we take very seriously. Unfortunately, incidents involving weapons in a hospital setting have become more common, and it's an investment, a small investment in the grand scheme of things, and a proactive step to mitigate risks before they escalate. So in making this decision, we carefully weighed the cost, the benefits, considering the increasing number of security incidents across our hospitals and across other hospitals across the province, and Canada for that matter. Again, nothing is 100% on its own, meaning this has to be coupled with other security measures like security staff, cameras, and other things that enhance security and safety of everyone who visits an emergency department. From the people I've talked to that have experienced this back in Windsor, is they had comfort knowing that the person next to them in the emergency department had to go through the same machine when they entered the department. And it took something off their mind that they didn't have to worry about or lessened it. Again, nothing's 100%, but it lessens the anxiety of concerns like that. So we appreciate these important questions from our community and we'll continue to share updates on this system as stated when it rolls out starting in April once training's done. The next item I want to talk about is our community advisory committee surveys. So as stated, I want to provide you a quick update regarding the status of those. So these surveys were shared with the community and our team internally to collect feedback and perceptions of LHSC on the care we provide, our governance, leadership, and operations. We received an incredible feedback with over 4,000 responses in total. I really want to thank everyone who contributed. So while the feedback clearly shows we have some areas to work on and improve, and I'll talk about when we're going to share that with the community and our internal staff, what was loud and clear is that this community appreciated the outstanding quality of care our team provides and knows how hard our professional staff, our employees, and volunteers are working. Our community advisory committee specifically wanted me to make sure I shared that with you this month. They said, please, while we're working on this report, make sure you share with the community. Thank you for giving the responses, number one, and number two, thanking our staff that the first results clearly reaffirmed our belief, and it's true, that our staff's doing an outstanding job in caring for patients and you and the community are thanking us. So I really want to thank you for taking the time. So what's next? So our community advisory committee has received a full report of all the survey findings, verbatim in a raw fashion. And now they're currently developing and working on recommendations that they're sharing with us at LHSC. And then we're going to be sharing with the community. We're hoping to have that to you in the April meeting. So stay tuned. That's our goal. Just because of the timing of the meeting, it might be May, but we're definitely within the next 30 to 45 days, we'll be sharing the community advisory committee, which is made up of volunteers from the community, we'll be sharing the results of that. So stay tuned with respect to that, but it's coming very shortly. Before we move to our presenters, I also want to take a moment, which kind of connects with the other issue, is to highlight our continued success with our Great Moments recognition program. Um, this initiative can't be shared enough. Great Moments was created to recognize outstanding contributions of our professional staff, employees, and volunteers. It provides patient, families, and community members with a simple way to express their gratitude by using a web form to acknowledge what difference staff has made in providing their care. Each submission is a powerful reminder the dedication, compassion, response has been overwhelming. As of today, over 1,000 staff members have been recognized, highlighting their incredible acts of care, innovation, and support that our team members demonstrate every day. So, what happens is when they're recognized, they get a certificate, they get a little uh, button that they wear proudly that shows that they've been recognized in the Great Moments program. And we share it not only with themselves, but with their team members. So everyone hears about the great work they're doing individually, collectively, and how they're being recognized by individuals from the community and staff internally. It's a very powerful program. And I really want to thank all of you in the community that have taken time to recognize someone here at LHSC. It means a lot for people to be recognized for the hard work that they're doing because sometimes, and we all take it for granted, and it's a great opportunity to be recognized. So again, if you've experienced a great moment, you can recognize a team member using the QR code that's on the screen. So now I have the privilege of introducing our next presenters. They're senior administrative and professional staff physician leaders of LHSC. They're going to be sharing information on various programs and services at LHSC and how we're working to enhance patient care. We're going to begin with providing our community with a very important update on the growing number of measles cases we're seeing in Canada, particularly in cases among children in southwestern Ontario. So now I'm going to hand it over to Shannon Meyer, who is our Vice President of Children's, Women's, Quality Performance and Pharmacy, and Dr. Michelle Barton Forbes, who's the Division Head and Physician, Pediatric Infectious Diseases, to give an overview of the measles situation and the actions we're all taking to keep our patients and community safe.
Hello, everyone. This is an important topic, and I just want to stop to explain what is measles. So it is a respiratory viral infection that is circulating currently, and it is a vaccine preventable disease. So you know that you have this viral infection when you start to have a runny nose, a cough, and a bit of red eyes, watery. But really, the signature symptom is the rash, and it's a blotchy rash, and it's the last symptom to appear. Uh, the important thing about measles is that it causes serious morbidity. So you can end up having to be hospitalized when you have measles. Um, so why are we seeing measles now at this time of in Canada? Why is this so? Well, measles outbreaks are occurring not just in Canada, right across the globe, and it is happening because we have had a fall off in vaccine coverage, and as well we have travel, global travel, and there are certain countries in the world where measles definitely is common, it's endemic. And then basically folks travel from those countries and come to our country. But within our country, we've fallen off with vaccine coverage because some people choose not to have vaccines, they're hesitant. And then as well, during the pandemic, we did have challenges with access and vaccinating folks. We've improved that significantly, but still we have pockets of communities that don't still don't take vaccines. And unfortunately, that may be because of religious or cultural reasons or fear and anxiety. But the bottom line is that we are not having the coverage that we need. And what we actually need is a 95 percent coverage in our community to prevent measles from circulating. And so even if we get to 95% generally, if we get into pockets where it falls off, then we have a challenge. So basically what's happening is that in Canada, specifically in Ontario, we are seeing the largest outbreak that we've seen that we've had in Ontario for the last 30 years. That's huge. So, and where is this happening? Unfortunately, the majority of cases are occurring right here down in the southwest and central region of Ontario. And um, we have reached a number that's just mind-boggling. 277 cases have been confirmed since March 12th. And unfortunately, it may be an underestimate because sometimes it's hard to track these cases. Anyway, um, here in London, fortunately, we have not seen that. We haven't seen cases begin to surge here in London. And we anticipate that in London, it won't be the same as certain other areas because we have fairly good coverage in London. 79% of cases are children under 19. So why is there this big ado about measles? Well, we are concerned as a children's hospital about measles because measles can cause serious illness in some children, young children, immunocompromised persons, not just children. If you are older and your immune system doesn't work well, then you can end up having measles, and unfortunately as well, or pregnant women. So these immunocompromised populations include like cancer patients, transplant patients, or patients who are on high dose steroids. That group of patients. However, when it does affect children, about 1 in every 5 children will end up needing some support in hospital because they may end up getting complications. Fortunately, most healthy children will not die from measles, but within the immunocompromised population, it can be quite serious. And you have significantly higher rates of mortality in that age group, in that risk group. So 40 to 70%, depending on how immunocompromised. The complications are most often pneumonia or sometimes diarrhea, dehydration, and less commonly, but serious, is the brain involvement.
Thank you,
So,
Michelle. Oh,
yes.
Shannon Meyer speaking here. As Dr. Barton Forbes said, we are very concerned with protecting our most vulnerable patients. Protocols are in place to contain and minimize outbreaks and measles in general early, which helps to prevent its spread to those who cannot be vaccinated due to medical conditions. In terms of the community's responsibility, we're really asking that you prioritize vaccination and education. These are key to protecting both high-risk patients and the broader community from preventable diseases. Slide. So we are taking action across LHSC in Children's Hospital and Women's Care. We have updated the care partner and visitor policy. You will find now that parents and care partners entering all of Children's Hospital and Women's Care inpatient and outpatient areas must be screened and be able to show proof of measles immunity. Alternatively, they will be asked to wear an N95 mask. Children, including siblings and other family and friends, are not permitted at this time. And we have area-specific guidelines allowing for either 1 or 2 care partners per patient. Importantly, exceptions will always be considered by the care team and our experts on a case-by-case basis, and we can help you navigate requests for exception if that's required. It's really important to us to support our teams and families, so we are navigating this challenge together. Decisions are based, when it comes to measles, visiting, screening, and other protocols on emergency management principles, infection prevention and control, and risk assessment. We consider input from our clinical leaders, administrative teams, from the community and our patients via patient relations. And policies are really carefully weighed to protect those vulnerable patients you heard about, but also considering the needs of families and caregivers and experience of our patients and families. Our team is continuously evaluating the situation, keeping a very close eye on what's happening in the province and the country to ensure that our policies remain responsive, patient-centered, and appropriate. With that, I am going to hand over to Deborah Weissman, our VP of Medicine, Emergency Services, Critical Care, Clinical Neurological Sciences, and our Corporate Nursing Executive, and Dr. David Stephen, our Department Head, Clinical Neurological Sciences, and our Interim Chair, Medical Advisory Committee.
Thanks, Shannon and Dr. Barton Forbes, for the important measles update and importantly, the monitoring and diligence you're taking with it. We appreciate that. Today, having celebrated International Women's Day on March 8th, it is a great opportunity for us to be recognizing remarkable contributions of women that shape the future of our healthcare. One of those incredible leaders is Dr. Ruth Lanius. She's a world-renowned researcher based here at LHSC and with Western University. Dr. Lanius's work is transforming how we understand post-traumatic stress disorder, or PTSD. This is a mental health condition that can happen after someone has experienced trauma, something that could be deeply frightening or even painful. Typical signs of PTSD include heightened heart rate, increased blood pressure, urge to fight or run, which we call fight or flight response. Dr. Lanius's brain imaging is using brain imaging to look at how trauma affects the brain. Her research has shown that people may respond very differently from each other. Some may freeze, some may completely shut down. Her research is also developing new and better ways of treating PTSD. This includes something called deep brain reorientation, or DBR. This is a form of therapy that actually helps individuals who are dealing with trauma, shock, and stress by teaching their brains to react differently to negative feelings. Dr. Lanius's research is helping us offer better care, more hope, and a stronger path to healing, helping survivors regain control over their emotional and physical reactions. Through her groundbreaking research, Dr. Lanius is making a lasting impact on those who are affected by PTSD. Her work is a powerful example of women in science and medicine that are driving research and changing lives. Next slide. Again, building on this celebration of International Women's Day, I want to highlight the exceptional contribution of an all-female leadership team at LHSC. This team is making significant strides in the contribution of care for our infants with congenital cytomegalovirus, or CCMV. This is a type of viral infection. We heard earlier from Dr. Michelle Barton Forbes. She is one of the leaders of this team. Leah Ethier, Debbie Zazborka. They all lead the regional CMV program at Children's Hospital in collaboration with over 15 community children's partners. This team is improving early detection and outcomes for the infants in our communities. A staggering 90% of newborns with CCMV show no symptoms at birth, leading only to about 1% being diagnosed early without screening. Early detection is crucial, as 20% of these infants may experience brain development delays or even hearing loss. Since the implementation of Ontario's universal newborn screening in 2019, this team have diagnosed and managed over 140 infants. This is a significant increase from just 3 cases diagnosed between 2014 and 2019. This program not only enhances the quality of care for infants in our region, but also serves as a model nationally and internationally. The dedication and leadership of Dr. Barton Forbes, Leah, and Debbie exemplify how women in healthcare are driving innovation and improving patient outcomes. I'll hand it over to Dr. Stephen to highlight a breakthrough treatment for epilepsy. David?
Thank you. Yeah, thanks, Deborah. Just want to talk a little bit about our epilepsy program here and highlight one of the many cases that that we've dealt with here at LHSC, and this one was actually highlighted in the news recently, so we felt it was something to bring to this group's attention. So Christine, who's happy with us sharing information about her because she's in the news. So Christine Cowson, this is her journey to a seizure-free life. So in 2020, she was diagnosed with epilepsy. And after she had been basically suffering severe recurring seizures, and the challenge was that her seizures were arising from not just one, but both of her temporal lobes, and this did not respond to medication, unfortunately. These seizures, as is typically the case, they caused memory loss, completely disrupted her daily life. She had to miss out of work and school. And so, 4 years later, after many investigations, Christine's neurologist, Dr. Anna Suler-Marty, one of my colleagues, recommended that she have a responsive neurostimulator, or RNS, surgically implanted. Thankfully, she actually hasn't had a seizure since this was inserted. Christine was actually one of the first patients outside the United States to have this procedure performed. And that's the novel aspect, in that it's not actually approved outside the United States. So the department had to seek specific approval for her. And, she's regained her memory and now living without fear and able to do all the things that normal people should be able to do. So just wanted to share that incredible story of Christine. And I now would like to pass things on to Jerry Plastino, VP Clinical Diagnostics, Pharmacy, Biomedical Engineering, and Dr. David Dryman, who's the department head and chair of the Department of Pathology and Laboratory Medicine.
Thank you, David, and thank you for sharing that story. That is incredible to hear about the types of procedures and access to care that actually is available here to us in London. But today, Dr. Dryman and I want to talk to you a little bit about pathology and laboratory medicine. And what is pathology and laboratory medicine, or what we refer to as POM? It's a medical specialty concerned with studying the nature and causes of diseases. It really does underpin every aspect of medicine, from diagnostic testing to monitoring of chronic diseases to cutting-edge genetic research and blood transfusion technologies. Next slide. So in terms of the makeup of the team, POM is a joint venture that includes both London Health Sciences Centre and St. Joseph's Healthcare. It's been in place for over 2 decades now, and really is a team that is committed to providing comprehensive range of testing, from routine to subspecialized testing that does clinical consultation with patients, not just for London, but the southwest part of the province, sometimes across Ontario and across the country. This team, as you can see, the makeup of the different individuals and roles and responsibilities that we have here, it's over 500 people that performs over 8 million tests annually. And Dr. Dryman will specifically go into the types of tests, but it really is a multidisciplinary team of experts who analyze samples, they make diagnoses, they provide treatment guidelines and recommendations, and are conducting leading edge research into those causes and diagnoses. So I'll pass it off to Dr. Dryman, who will then speak to the specialties and then also talk about some of the key initiatives that are underway. Dr. Dryman.
Thanks. Thank you very much, Jerry, and good afternoon, everybody. Thank you for joining us today. Some of you likely know that over 70% of medical decisions rely in whole, or at least in part, on laboratory results. This helps to explain how we got to do over 8 million tests in 2024. The importance of our diagnostic service was recognized by no less than the revered Canadian physician, Dr. William Osler, when he observed in 1909, "As is our pathology, so is our practice. What the pathologist thinks today, the physician does tomorrow." Virtually every patient, from those in emergency rooms to surgical suites, receives laboratory testing. Our laboratories, our core laboratories, handled over 6 million tests last year alone, highlighting the rapid response capability required for our high patient volumes. We also provide bedside or point of care testing, which refers to tests performed at the patient's bedside. This is an extremely important aspect of our operation, and we are seeing more and more tests moving to point of care testing, even including genetic testing, which will be coming in the future. Our molecular diagnostics laboratory plays a crucial role in analyzing patient materials at the genetic level, directly influencing cancer treatments and hereditary risk assessments. This effort supports the hospital's genetics program, benefiting patients across southwestern Ontario and beyond. Our pathology division provides critical diagnostic services, examining all tissues removed during surgery or biopsy. When a patient has a biopsy in one of our ORs or in a clinic, that tissue is sent to our department for examination by a pathologist. Pathology here is centered at University Hospital, and in fact, we have the largest single-sited pathology program in Canada. Last year, our pathology team managed more than 84,000 cases, which is a significant achievement reflective of the diagnostic expertise within our institution. Next slide. Our microbiology lab is integral to the diagnosis of infectious diseases and the management of infectious disease outbreaks alongside our infection prevention and control program. Transfusion medicine safely manages blood products and tissues for thousands of patients each year, including across 7 regional hospitals, as well as through some home care services. Transplant immunology handles testing for people waiting for transplant, assessing compatibility, and is involved in monitoring for rejection. PALM also has a key regional role supporting at least 7 hospitals in the Southwest region, ensuring that high-quality laboratory services are accessible across our community and region. Next slide, please. Finally, just to talk about some of our department's key initiatives. In PALM, we remain firmly committed to leading healthcare innovations, supporting life-saving research, and ensuring that every patient receives timely and accurate diagnoses. A key initiative focuses on genetic and precision medicine. We're actively expanding our support for important provincial initiatives such as the Ontario Epilepsy Genetic Testing Program, rare disease diagnostics, as well as familial hypercholesterolemia. These efforts are essential for precise diagnosis, individualizing treatment plans, and improving patient outcomes. We are taking a leadership role in Alzheimer's disease diagnostics, investigating the use of blood-based testing for Alzheimer's disease. This very cutting-edge initiative is crucial as it paves the way for earlier detection of Alzheimer's disease, which can significantly impact the development of effective new treatments, enhancing patient care and quality of life. A third initiative addresses efficiency and automation. With increasing demands on laboratory services, we plan to make strategic investments in next-generation laboratory automation. These advances will help us manage higher testing volumes efficiently and effectively, while reducing wait times and ensuring faster, more accurate patient results. And lastly, we are committed to expanding our surgical pathology capabilities. This initiative aims to enhance our support for personalized treatment options through advanced biomarker testing. By strengthening our capabilities in this area, we empower our clinical colleagues, such as oncologists, with precise diagnostic tools necessary for tailoring individualized therapies, ultimately improving patient care and outcomes. Thank you again for your attention and interest in the work carried out by our PALM team members. We remain dedicated to being a nationally and internationally visible community of staff, clinicians, scientists, educators, and learners, dedicated to being the cornerstone of the patient journey, united in the pursuit of knowledge, quality improvement, and healthcare excellence. With that, I will hand over to Nick Vacolius, CFO and VP of Facilities, Chris Askew, Director of Facilities, and Emily Hahn-Trinker, Director of Support Services, to talk about facilities management and support services.
Thank you very much, Dr. Dryman, and for that presentation. Today, both have Chris and Emily helping with the presentation, and we're going to talk about our facilities and also our support services. So next slide, please. How big is London Health Sciences Centre? And I don't think everyone understands how big both sites are, and our 8 community sites. So we're one of the largest hospitals in Ontario and one of the largest hospitals in Canada. Therefore, we have a lot of square footage across all our sites. It's over 3 million square feet, and that is a significant amount of square footage that we have to take care of from a facility side and from a support services side, and also lots of walking, and you'll hear from Emily shortly. The Victoria Hospital site has 79 acres, and it is probably one of the largest hospital sites in Ontario. University Hospital has approximately 25 acres, and the power plant, which is 6 acres, which is located just off south of Commissioners Road. And then we have this large swath of land that is just south of Commissioners, right across from the Victoria Hospital site, which is 65 acres. Then on top of that, we have 8 care sites located within the community. So just based on the square footage, the acreage that we have, we are probably one of the largest landowners in the London area. And with the 8 sites located, we touch almost every part of London, of the city of London. Now saying that, I'm just going to hand it over to Chris Askew for the next slide.
Thanks, Nick. So as Nick mentioned, all the extra space that we have, the square footage, we do have over 7,000 parking spaces between Victoria and University hospitals that we have to maintain. This past winter was a challenge with all the snow that we had, but our team was able to manage, and our contracted partners were able to help us out. With all that square footage, over 3 million, we have a dedicated internal team of trades, from carpenters, plumbers, electricians, millwrights, steam fitters, and locksmiths, who completed over 51,000 work orders in the last 2 years to maintain and ensure patient care is not interrupted at our facilities, and to help our clinical teams continue to provide the excellent care that we have. In addition, our internal trades work closely with our projects team, who had over 700 project requests in 2024 alone. Some of those major projects help continue the care in our community and expand those care opportunities that our community can provide to the region. And with that, I'll pass it over to Emily for support services.
Thanks, Chris, and good afternoon. It's my pleasure to share some of the amazing metrics and achievements of our support services team here at LHSC. There's 9 departments that make up this incredibly diverse department, and over 800 employees. So our porters move a lot of people and a lot of materials through our campus. We did about 600,000 trips last year, and a porter will walk about 30,000 steps in a shift. Keeps that team very busy. Our mailroom processes around 40,000 pieces of outgoing mail monthly that are being delivered to our community across the province. switchboard is a very busy department here at LHSC. They're taking about 1.9 million inbound calls a year, and keeps that group busy and keeps all of us connected here in the organization. Our laundry and linen team is very busy and working to ensure all of our programs stay outfitted accordingly for the work that they do. And we're doing a lot of work keeping the surgical scrub program where it needs to be, with about 7,300 sets of scrubs a week dispensed from that program. And you're going to see later in the slides, environmental sustainability is a cornerstone of what we do here at LHSC, and we're working hard with all of our paper and our forms management to make sure we're reforesting trees, offsetting our paper consumption here in the organization. Next slide, please. So food, something we love talking about, and we're really proud of here at LHSC. So our patient food services department has been very busy lately. We're doing about 9 times a day. We prepare and organize all of our food for LHSC at our Victoria campus, and we truck it around the city and get things up to University Hospital accordingly. Almost 1 million meals served in 2024, which is a number we're really proud of. We're one of the busiest restaurants, I like to tell everybody, in the province and probably across the country, making sure our patients are well on their way to good nutrition and health. Infant nutrition is also something we're really proud of. So we did over 100,000 infant feeds, whether that's breast milk or formula, in 2024. And we can't forget about our retail food outlets, 17 outlets between our 2 campuses, and they processed 1.5 million transactions last year. Next slide, please. So like I mentioned, environmental sustainability is something we're really proud of, and making sure we're doing our part to ensure sustainability in our organization is key. So our patient food kitchen has a very significant effort underway to recycle all of our organic waste, and that was over 300,000 kilograms last year. And you'll see in the chart below, recycling of just all of our cardboard and recyclable materials, confidential paper, and organic waste. Those volumes are significant, probably as big as some of our small cities surrounding us in terms of our waste diversion for 2024. Thanks for your time. I'm going to pass it over to Shannon Meyer and Dr. Patricia Hall to talk about our children and adolescent mental health and wellness programs.
Thanks, Emily. Just as Emily mentioned, I'm Dr. Patricia Hall. I'm the Department Head of Child and Adolescent Psychiatry, but just very mindful of the fact that I do represent a large multidisciplinary team. And this is a team of people dedicated to the care of the children and adolescents in our community. And I'm quite humbled and honored to be able to provide the update today. Just before we get started with the slides, I think we'll just move to the next slide. I just want to be mindful that, as a team, we work with children and adolescents every day and deal with mental health, and that there's families and patients that are listening right now to the update. And there's maybe some people that this presentation could be a little bit sensitive. So I just want to say that the presentation does include sensitive topics such as mental health statistics and details related to children and adolescents that may be triggering or concerning. So please prioritize your well-being and step away if needed. Thank you. So we'll go to the next slide there. It's important, you may have heard this, but we just want to express in the statistics that there's a rising need for child and adolescent mental health and addictions care. So what you see in the graph is the visits to the emergency room. This is our pediatric emergency room in London. And the emergency department, it's often the last resort for youth facing mental health crises. So as you can see, post-pandemic, we did have quite a large increase in our emergency room visits. And about 30% of all child and adolescent hospital admissions at Children's Hospital involve mental health care. And our next slide, please. Thank you. So just to go over some of the trends in mental health hospitalization that we're seeing with children and youth. So the hospitalization days for inpatient and mental health care has surged over the past 5 years, once again, sort of orienting to that, the 2020-2021 pandemic year. So we're seeing a 43% increase in pediatric intensive care unit care days. We're seeing a 36% increase in acute care hospitalization, and we're seeing a 45% increase in specialized long-term tertiary care for youth. The inpatient hospitalizations have increased in volume, but also quite significantly in complexity. And this is reflected in behavioral issues, self-harm, and suicidality. The pandemic, as mentioned, intensified the issues, and especially for females aged 15 to 17. So overall, for our inpatient unit, we're seeing a greater demand, we're seeing more acuity, and we're also seeing growing barriers for discharge due to limited post-hospital care options. Next slide, please. Thank you. So in our outpatient area, we've also seen dramatic increase in demands, and we have needed to mobilize and improve access to our outpatient and reduce wait times in that area. So mental health waitlist has been a key priority in order to get timelier access to care for our youth. Since June 2024, the wait list for service has reduced to 4 to 6 months, and that is what the graph is showing. So you'll see that we have different streams of service in our outpatient, and those are around the types of treatment and care we provide. So DBT is a type of therapy that helps with suicidality and self-harm. We have mood and anxiety, trauma, and a general stream listed there. So what you may see with the green line is that the trauma program experienced a slight increase in wait times in January and February. And why that's important to note is it's just important to realize how specialized this area is, and the significant great need for recruitment of specialized roles to provide care in this area. Thank you. Next slide. So we are encouraged that more youth are seeking care. It's a sign of growing trust in the system, and it's a greater awareness of mental health needs. Youth seeking care, they do tend to be younger, with the average age shifting to 14 to 15 years rather than the older adolescent. We are seeing increased substance use presentations in this age group and a broader range of drugs that are being used. We're seeing higher levels of socioeconomic stress in our families, communities, and for our patients. We're seeing financial strain, housing, and food instability. We're seeing more cases involving trauma. So this is post-traumatic stress disorder, which was described earlier in this presentation. And that can include children that have experienced war and trafficking. And we're seeing rising reports of self-harm, suicidal thoughts, and depression and anxiety. Our next slide, please. So I think after going through those slides, this is a timely slide in terms of what are we doing? What is the response to this increased demand? And our team is very committed to getting youth the right care at the right time and the right place. We are innovating and learning and wanting to enhance the patient journey. We want to improve care for kids and families by building capacity and supporting our teams. So in the emergency department, we added a mental health team to the emergency room that includes a nurse, social worker, and a child and youth counselor, and that's 24 hours a day, 7 days a week, to provide an improved experience in our emergency room for those experiencing mental health crises. For our inpatient unit, we've addressed space issues and we have expanded capacity for the pediatric intensive care unit area. We've improved our regional intake, which means there's easier access for those that live in our region, which is Ontario West. We've recruited psychiatry, so we've gone from 2 inpatient psychiatrists to 6 inpatient psychiatrists, and these would be subspecialty trained in the area of child and youth units. In the outpatient care area, we completed a redesign of ambulatory care services, and this did result in a waitlist reduction from that June 2024 from 18 to now around 6 months. We have also almost tripled the amount of psychiatrists in our outpatient area, and we've increased the total number of therapists in order to improve access to care. And then with that, that's the end of my update, and just wanted to really reflect that it's an honor to work with the children, youth, families in our region. And thank you very much for having me.
Thank you, Dr. Hall. We're so proud of the teams and yourself and the specialized care that we are offering through emergency inpatient, outpatient care, working so closely with partners to advance mental wellness and support for children and youth across our community and large catchment. And with that note of pride, I will hand this to Deborah Weisman.
Thanks, Shannon and Dr. Hall. I'm reminded as we close out the 3rd community meeting how special an opportunity this is for us to be in front of our communities, for our teams to really highlight the important work that they're doing. So thank you for attending. Want to highlight that we do have a web form for any questions that you may have. You can find that on the YouTube, the web pages where we've got our community update meeting link or on the QR code on the screen right now. Since our last meeting, we did have one question raised, and it was highlighted by David at the front of the meeting around our weapon detection system. So we are very appreciative for any questions that come in, and certainly encourage you to use one of those 3 opportunities to submit any questions that you may have. I want to thank you for attending today and joining us for this special opportunity. Our teams are thrilled to be virtual with you, sharing important messages and notes of the work their teams do every single day. To our media partners, just a reminder that we will have the media scrum starting at 1 p.m. where we look forward to answering any additional questions you may have. I want to wish everybody a great day. Thanks for attending. Bye-bye.